Hey everybody, welcome back to Healthy Ass, where we talk about everything public health related and more. I'm your host, Enrique DeAnda with Cameron County Public Health. In honor of National Nutrition Month, we will be discussing the importance of maintaining a balanced diet and a healthy lifestyle. Join us as we speak with Arron Salinas, the assistant professor at UTRGV's School of Nursing. Thank you for joining us.
Thank you so much for having me.
So, Mr. Arron Salinas, tell us a little bit about yourself.
So I'm from Edinburgh. I've born and raised in Edinburgh. Currently, I'm a nurse practitioner. I'm a board certified nurse practitioner in family medicine and psychiatry as a psychiatric mental health nurse practitioner. So I see patients with UT Health, and I also see patients at Brownsville Kitty Health Center with Dr. Rocco. So a lot of what I do, I also I'm a faculty member with a university, with the School of Nursing. I'm actually the program coordinator for the undergraduate BSN. And a little more about what I do. So I do research. My area of research is pediatric, and my specialty is, or what I'm really passionate about is mental health in kids.
How important is it for your kids to get the proper nutrition? I know that we're busy. I mean, I'm a parent of 2 kids myself, and it's not always the easiest thing to make sure that they're getting the nutrition they need. So from what recommendations would you make for a parent to make sure that their kids are getting, the nutrition they need?
So it's extremely important, and we hear about this a lot, as kids go to school. We hear this on television, social media. That's extremely important, that children develop healthy eating habits at a very young age. Obviously their nutritional status at a young age will lead to their growth and development, and that's something that we all, as clinicians, we all strive to, making sure that we have our kiddos go on the right path, right? That will help them have lower chances of developing chronic diseases, feel better, and really enjoy life, right? So some of the recommendations that we have for parents is really think outside of the box, right? A lot of times parents will come in and they'll say, you know what, my child doesn't like fruits and vegetables. And one of the things that's very frustrating is I hear a lot, well, my child is picky. And the thing is, kids are picky, right? But at the end of the day, mom and dad, it's our duties and our tasks to really introduce them to the different fruits and vegetables or whatever, you know what I mean? Like whatever we know that is healthy. And if you don't introduce them to them, then they're never you're not gonna know if they like it or not. And that's the reason why I've been referring a lot to nutritionists and I know like HEB. I know that there's several organizations where they have like nutritionists have different sessions on cooking, and they'll teach them different strategies just to get creative, just to find a way that hopefully your child is gonna find this meal or this snack more pleasant, and that'll go a very long way, instead of just saying, you know what, my child doesn't like, for example, carrots or apples or whatever. There are a lot of options. We just have to explore them, and the important thing for us to do is to really make sure that we know what resources we have. So HEB is a big one. HEB is a really big one. Sprouts and some of the local organizations also have information on nutritional, different nutritional strategies or classes or sessions, and that's always important to know and explore. Yeah,
that's something that I thought about a lot when I was reading up on the show today. I was thinking of my personal experience, and I was thinking a lot that my kids, I am blessed, love their fruits and vegetables. They adore them. I mean, they snack on little bell peppers. It's the funniest thing. But I think a lot of that comes from me, and I think it's because as parents, we're not aware that we doing it. So if we want our kids to do it, we have to be more willing to do the same, and they'll pick it up after us. They'll see us and they'll model after us, and they'll say let me try that or do something. And even then, I remember initially, when I was trying to get my kids into broccoli or something, of course, everybody immediately does that, cheese and bacon and all this stuff. But eventually, you start stripping it down to the point where my kids they're happy with their broccoli just with a little salt and pepper. So I think that's something to keep in mind. It's a lot easier when you make it routine. and instead of like trying to introduce it like all at once or something. I think like what you're mentioning is talking to a nutritionist,
Right.
so you can help plan some strategies, or get a game plan going to like help, bring this into your regular diet. So, I mean, I know it's really easy just to like, I don't have the time, I don't have this, I don't have a soul, like fast food. It's always the go-to, and the thing is, it's easy because it's there, but people don't realize, how much stuff goes into it. There's a lot of stuff that goes into processed foods. So I know that there's a lot of things associated that you don't necessarily think about. But what are some of the risk of having, a diet rich in processed foods?
Okay. So that's a good question, but I just kind of want to highlight on something really quick that you just mentioned. So we all live our lifestyle and how we live now compared to 10, 20 years ago is very different, right? We've seen now that fast food and a lot of these a lot more accessible, even the prices, and it's a lot cheaper to go to McDonald's and buy something off the dollar menu than it is to cook something at home, right? And that's a big problem. That's a big problem, right? And I think a lot of it has to do with our lifestyle, and we don't take the time, or we don't make the time. And in regards to processed foods, in the population that I serve, which is in a pediatrician's office seeing kids, we see kids that are like you mentioned, their parents will, again, they work and they live a very busy life, so they'll tend to go with a lot more of your processed foods. They're quicker, easier accessible, versus having to cook something and that kind of thing. But we also have to consider that think about it, how in order for these foods to have like a prolonged shelf life, because we don't know how long they're going to last compared to something that is, I guess, grown naturally or whatever. So there has to be ingredients that are there that are gonna help prolong it, right? Because we don't know how long it's gonna last. So some of the things that these items have are obviously added sugar, more sodium and more fat, and these are things in our diet that we really want to try to minimize or eliminate if all possible, right? These are some of the big contributing factors to a lot of the health issues that we're currently seeing, which is obesity, diabetes, high blood pressure, cardiovascular disease, and issues that are huge all across the country, but even more so in our area. Look at a lot of the recognition that we've seen in the Rio Grande Valley, having cities around us being labeled as the fattest city in America. That's not something to be that anybody wants to be recognized. And I think Brownsville is really leading efforts with a lot of physical activity measures and a lot. They're very proactive in regards to that sense. So I commend the folks from Cameron County and especially Brownsville for leading those efforts. I think they're way beyond anyone else in the entire Rio Grande Valley, and where they're at with that. So again, that goes hand in hand. When we're talking about the types of foods and items that kids eat, yes, their diet is a big part, a big factor, but we also want to make sure that we encourage physical activity and exercise, and that will allow them to lead to a healthier lifestyle as they get older.
Yeah, I totally get that. And like you mentioned earlier, like people don't realize how much salt is in thing, how much sodium, and that, we do know how that affects heart disease and everything, but, salt is a preservative, so they need to add it to a lot of food that we get in restaurants and stuff to give it the longer shelf life so that they can get, the maximum profit out of it. But it's pretty unhealthy when you look at it. And, retroactively, like also sugar, it's an additive to make something taste better. So that's always an issue. And especially, with the Valley and the issues with diabetes. I mean, me personally, my dad has diabetes and runs in my family. So it's something that I'm very aware of and conscious of. So like I'm very careful to try to limit the amount of sugar that I take. But thinking about that, like, when it comes to your kids, we're so quick to say, he's young, he can burn it off, or he's young or something. And I think that's, that's setting a weird precedence, because, you're just setting up your kid to constantly need that sugar, to need that. And so like, what do you consider some common signs of like possible diabetes in your child, or the development of prediabetes or high blood sugar?
So one of the more common signs, and I'm sure, if you have kiddos, I'm sure, and they're in elementary or they've gone through the school system, I'm sure you've you've heard of the testing that gets done where they, they get their weight and they measure, their waist circumference and things like that. But they also look at their neck. It's called acanthosis nigricans, or they call it AN, right? So what you'll see like an indentation on their neck that'll start to get darker in comparison to the rest of the skin. That's very common, right? And that has to do with insulin resistance. So that's one that's common. But some of the other common symptoms or manifestations that you'll see is obviously increased urination, increased thirst, feeling thirsty all the time, like even not, if they're drinking like high amounts of water. Unexpected weight loss, without having any kind of intention, just losing weight without even trying. That's also a common one. Feeling hungry all the time, no matter how much they're eating, they're still going to be hungry. Feeling tired, fatigue. One of the things I've seen in kiddos has been behavioral change. And a lot of times, we don't consider, because typically you wouldn't consider diabetes a problem of kids, or at least that's how it used to be, right? But within the past 10 years, that has been something that we've been seeing a lot more. That has to do along with the higher number of cases of obesity that we have, and things like that. So those are some of the more common ones, and one of the ones that I really need to mention is like a fruity odor, and I think I've had like one or two cases that they've been a little on the extreme, and they when they presented, actually the first thing that they came with was the behavioral change. We did some basic labs and we collected some urine analysis, and we saw that what the results were, and so that's one that I definitely have to make sure that I include. These are all common, and we must make sure that we're aware, and especially having the family history. That's always a big, some of the things that we need to be on the lookout.
So, I mean, aside from the obvious, the sugar intake, can you think of any other things that an adult or a child could do to like help prevent the risk of diabetes?
Well, so we always recommend. So obviously, keeping in tune with your yearly appointments with your primary care provider, making sure you get your yearly exams, making sure you get your labs, making sure that you the recommendation for physical activity, and I'm sure everyone is aware of the American Heart Association recommendation is at least 150 minutes of exercise, right? And so make sure that we're moving, make sure that we're really eating the right things, right? And I know it's easier said than done, right? But we have to make sure that we introduce kids at a young age to a lot of our healthier foods that we want to make sure that they start to consume, right? Such as seafood, your lean meats, your poultry, your egg, your beans, your peas, your soy products, your unsalted nuts. And so again, like I mentioned earlier, the healthy lifestyle, the being physically active, these are factors that'll help and prevent diabetes. If someone has like a high risk factor and someone has like the family history, obviously they will get it, right?
Yeah.
So we are going to do everything we can to make sure that we prevent it or delay it from happening, and that is the way to do it. Physical activity and diet.
So I was thinking just right now about as you were talking about the things that Brownsville has been doing to try to promote a healthier lifestyle, and I live in Harlingen, so I was really excited when they started putting up trails everywhere.
Right.
So now there's all these interconnected trails, and just one day out of curiosity, I'm like, well, let me see where this goes. I ended up walking 2 miles and not even realizing it. And it was like, I think it's great because I see families out there, they've planted trees, and I think it's great that the city's promoting, to get out and walk. And it's something that as a family you can just do. And like I said, if you set the bar for your kids, they'll follow along. Right. So, promoting, a healthy diet or what you're eating and your physical activity. And I think that'll help limit your risk of diabetes.
Right. And right now, so I'm sure you're aware of what is it, the ITT challenge? Yeah. Cities and everyone, like it's a way to get everyone like really moving, right? So that's a huge initiative, and I think over the past couple of years it's really become very popular, and it's not so much about the competition, even though like they try to make it fun, try to make it engaging, but it is a way to get people out there and get moving, and you work as a team. Having the support is big, right? When you're trying to make it's not necessarily a diet or whatever, but a lifestyle change. That's what we need to do, and that's where we'll see progress by lifestyle change, being consistent and having a good support. That's important.
Well, I mean, I think just the mentality to have is, baby steps, right? I mean, small steps is all it takes to eventually get there, whether it's a change in your diet or a little more physical activity. So I think that's a really healthy attitude to have. And I think that'll, help you get to the goal that you're trying to reach. So, I really appreciate your time today. I think we covered some great subjects, and hopefully we can reach people to make better decisions in their diet and their lifestyle. So
thank you so much for having me. Appreciate it.
Join us again next time on the next episode of Health Yes. Remember to follow us on Spotify and subscribe to our YouTube channel. Thank you so much. We'll see you again next time.